Everyone. I'm Brett Weber with the National Indian Health Board. Thank you so much for joining today's webinar. We're going to give it just another minute for folks to join. Sometimes it takes a minute for Zoom to let everyone in. So we'll get started in about 30 seconds. If you need a quick bio break, or if you suddenly realize that you've left your coffee on the counter, now's a good time to go get it. We'll get started in just a minute. Okay, I don't see anyone else in the waiting room, so let's go ahead and get started. Just a quick note, this session is being recorded. If you don't consent to being recorded, please do drop off the call at this time. You can always view a recording on NIHB's website at a later date. Okay, so thank you so much. Again, my name is Brett Weber with the National Indian Health Board. I am moderating this webinar session on enhancing tribal environmental health programs, engagement in COVID-19 response webinar series. We're excited to have Jerry Pardilla and Garet Gouch with us as today's presenters. They will start with an overview of the use of the Geographic Information, or GIS, tools for contact tracing to respond to epidemics or pandemics with air, food, and waterborne disease transmission. Following the presentation and live demonstration of the contact tracing prototype, I will discuss potential use and deployment of the contact tracing prototype through a pilot program that NIHB is happy to support. Before we start, just a couple of housekeeping notes. Again, the session is being recorded. The presenter's PowerPoint slides and recording will be available for you to download later. I know that's always a question folks have. I've also enabled live transcript for the meeting today. If you wish to hide the live transcript, just click the live transcript button and then hit hide subtitle. All participants have been muted, and please do leave yourself on mute unless the presenter specifically asks you to unmute. There are quite a number of folks on today's webinar. So just to keep a little bit of order, we are asking folks to stay on mute. We encourage you to enter questions into the chat box throughout the webinar. We're going to pause a few times during the presentation to answer chat questions as time permits. And if you have any technical difficulties, please do reach out directly to me via the chat function. So, and then also you'll be asked to, at the end of this webinar, fill out a short evaluation. Your feedback is very helpful to us at NIHB, deliver quality webinars and topics to you. So please do take a couple minutes out to fill that evaluation. So let's welcome our presenters. Jerry Pardilla has served as the Director of Office of Environmental Resource Management with the United South and Eastern Tribes, or USET, since 2012. Prior to joining USET, his professional career has been dedicated to serving Indian country in tribal government and tribal organizations. He has an extensive understanding of tribal natural resources and sustainable development issues gained through both national and regional service, including as Director of the National Tribal Environmental Council and Deputy Director of the Alaska Intertribal Council. Jerry is a citizen of the Penobscot Nation and served in leadership positions of governor and CEO, lieutenant governor, and tribal council member. He has a traditional background, lineage as a songkeeper, and was instrumental in revitalizing the Wabanaki Confederacy, Penobscot, Passamaquoddy, Maliseet, Micmac, and Abenaki peoples. Jerry also has Kiowa lineage as well, and following his family traditions was inducted into the Kiowa Gourd clan. He is a veteran and served as commissioned officer in the Maine Army National Guard. Our second presenter is Garet Gouch. A Shawnee citizen, Garet is a co-founder of the National Tribal Geographic Information Support Center, also known as Tribal GIS, a nonprofit organization to aid tribal governments and tribal organizations regarding geographic information technology. Aside from serving as a volunteer with Tribal GIS, Garet is also the business manager for Wind Environmental Services, LLC, a Native American owned and operated GIS firm. He works to support tribal communities with an understanding of how geospatial technologies and research have been used to strengthen tribal communities through various applications. In addition, Garet continues to encourage professional peers, young adults, and youth to enhance their GIS skills that will open the doors to many opportunities throughout a number of career fields. So I'm going to turn it over to Jerry first. Go ahead, Jerry. Thank you so much.
Very good. Thank you for that introduction, Brett. I'm really pleased to join you today to present to you this GIS technology and how it can be applied to contact tracing. So first, I would like to just give you a brief background about United South and Eastern Tribes Incorporated. Our organization was established in 1969 as a 501c3. We are regional. We comprise an area from the northeastern woodlands to the Everglades across the Gulf of Mexico. We have 33 member tribal nations, and our organization motto is strength and unity. We have a basic mission of dedicating our work to enhancing development of tribal nations and improving quality of life through various technical and programmatic services. I'm the director of the Office of Environmental Resources, which is one of our core program areas. We are also joined by economic development, tribal health program, support services, and a tribal epidemiological center. So this work was undertaken with a collaboration with the National Indian Health Board and my department, the Office of Environmental Resource Management. Our overall project goal was to enhance tribal environmental health program capabilities and engagement in COVID-19 response and prevention efforts. Our project spanned from April to October of 2021, so a very condensed timeframe in which we undertook these activities. Our specific project goal was to develop a report and design guide to aid in the rapid development and deployment of geospatially enabled community contact tracing and reporting tools. To do that, we engaged a subject matter expert to take this concept all the way to develop a report and design guide and ultimately produce a functioning prototype. The subject matter expert that we chose was Wind Environmental Services and Garet Gouch, with whom you have been introduced and is our co-presenter. We had a number of elements involved in this, which included outreach and convening stakeholder meetings with tribal epidemiological and health professionals. There were technical and implementation elements which addressed necessary database elements, software, and IT system architecture. And an interesting element was that United South and Eastern Tribes has a web-based platform that that's still under development for providing risk assessment tools for tribal nations. And so there has been some confusion over what tool we were working on, but one was really the server platform to develop the contact tracing prototype. And it's the prototype that we'll be talking more about, or you'll see the demonstration video following my introduction of that. So ultimately what we were able to produce was a report and design goal, a design guide, and a functioning contact tracing prototype. And we delivered a video demonstration of that to Brett and the National Indian Health Board in late October. We were very excited to go beyond our initial goal of producing a guide to actually having this prototype. We were able to do this with a very successful collaboration with NIHB and teamwork with Brett and all those that were engaged in this implementation. We anticipate that this prototype would be transportable and could be used by tribal communities and epidemiology centers to respond to air, food, and waterborne disease transmission. So it may apply to epidemics, but like COVID-19, but may have a longer usefulness than looking at COVID-19. So I'll end there. Really pleased to be part of this webinar. And I'll hand it back to you, Brett, for introduction of our subject matter expert.
Thank you so much, Jerry. Really appreciate that overview of the project. Garrett, do you want to go ahead with the demonstration?
Sure. So at this time, we're going to start off with just giving you a tour, if you will, of the application that was built based upon the feedback from a community kind of focus group that we had established earlier this year of kind of identifying the needs that would be beneficial and kind of how this dovetails together. So without further ado, we'll go ahead and step through that demonstration and then reconvene back here. And certainly feel free to have your questions armed and ready when we get to that part. Today's tutorial is going to start by examining the system design and talking about the key elements of the system, and then we'll migrate into hands-on demonstration of each of the interconnected components. The system was designed to provide a streamlined approach for data collection, aggregation, initial visualization and analysis, and export to third-party systems in support of community contact tracing. The entire system is built with security in mind, and the servers reside in a firewalled, protected environment, and access is granted through virtual private network or VPN connections to maintain the integrity of the data and the privacy of the information collected. The system is made up of a number of components, starting with field data collection that is based on using the Esri Survey 123 platform to provide digital data collection for investigations relating to an epidemic or pandemic, to streamline the data collection both in an electronic form, but also in a way that will allow for aggregation into a single system so that the data can be entered once and used many times in many different environments. When the data is aggregated into the ArcGIS server environment, this allows us to perform some basic initial analysis and visualize the information through data dashboards and web applications. This allows us to do initial hotspot mapping. It also allows us to identify key demographic or pertinent information that we want to see in a real-time manner as investigations are being conducted to visualize and assess the situation. Ultimately, the data can then be exported out to a number of formats or connected to other applications using a REST endpoint to provide for further more advanced analysis, such as link analysis of the data. We're going to start today's tutorial similarly to how the workflow would be expected in the field, and we're going to start by examining our data collection forms for both respiratory, foodborne, and waterborne illnesses. So at this time, we'll go ahead and switch over and start walking through the field data collection applications. After you've downloaded the appropriate VPN application and securely connected your tablet or phone device to the USET GIS servers, we will start by opening the Survey 123 application and initially establishing our connection to the GIS server by going to the Manage ArcGIS Connections button. When the ArcGIS Connections window opens, we are going to start by adding a new connection. For the connection URL, we are going to type in gis.usetinc.org/portal. Once we've got our address for the GIS portal that is securely protected behind the firewall, we're going to click Add. And we now have our enterprise connection to the USET portal. So when I click the back button, I now have the ability to log in to the USET GIS portal by clicking the Sign In button. At this time, I'm going to enter my user credentials and click Sign In. Once we've logged in to Survey 123, initially we're not going to see any surveys. We need to first go in and download the available surveys to us by clicking the Download Surveys located at the bottom of the application. In today's example, we will have a respiratory illness cases example to examine. We will also have a foodborne or waterborne illness cases example. Likely, in the event of an actual epidemic or pandemic, we will likely have modified these illness case examples to be customized to the particular event. So most likely these would be provisioned with special questions or attributes pertinent to the specific pandemic. Once we've identified the surveys that we need to download, we will do this by clicking the icon on the right that looks like a cloud with an arrow. This will download those surveys to our device. Once we have the surveys downloaded, we can click the back arrow, returning to the main window in Survey 123. As you can see, we have both of our surveys available for us to complete, and at this point I would be ready to head into the field and start conducting my investigations. We will start with the respiratory illness case. Once we are at the location and we're ready to conduct our investigation with the potential subject, we will click on the survey, and we're going to click the Collect button to start a new survey with a specific patient. Once the form opens, we're now ready to begin our survey. A key element of a geospatial community contact tracing data collection form is collecting the geolocation of the subject's home address. We can do this a couple of ways in our smart forms. If you happen to be at the subject's home, you can simply use the automatically derived location that was derived using GPS off of your tablet or smartphone. If you're doing this interview remotely, either at a health clinic or over a phone, we can also derive that location by simply Xing out of the automatically generated location, clicking on the map icon, and browsing to the location where the subject lives. This process can be done very accurately. We can start by getting a general description from them of where their home may reside, and start zooming the map into that general geography. As we get closer to the subject, we can also switch our base maps, where we could turn on aerial imagery or any other number of available base maps to help us define exactly where our patient lives. Simply zooming in, selecting the house, and saying that's where they are from will allow us to then click the check mark and return back to our form and start the process of entering in the various data fields. Our first question up is going to be the date of entry. And we have the smart form designed in a way that it's automatically going to select the present date and time that you are conducting the interview. To accept this, simply just go ahead and click on the date and it will pre-populate the field. Date of interview, if we are doing this live, we can enter that in just simply the same by clicking on the field, and it will automatically select today's date and time. If for some reason the interview occurred at a different time, you could simply select that date in the calendar and adjust the time appropriately. Moving along, we would enter in the patient's name and information. So today we're going to be interviewing Jane Doe. If applicable, you could enter in a health record number, and then we would go ahead and populate the individual's address in a tabular form, keeping in mind that these data fields can be added, removed, or customized for a particular epidemic or pandemic event. But we'll go ahead and enter in our street name today, and our home city is going to be Nashville, and our home state, we simply select and scroll through until we find the appropriate state. Again, we can set a default on this if it is easier to navigate. And then we're going to key in our zip code. Moving through this form, this is a smart form, so you're not going to see all of the fields initially as you go through. They're going to appear or hide based upon subsequent questions. So for example, the question of, are you currently employed? If we answered no to this question, that's simply the end of the answer. If we answer yes, it's then going to ask us for our workplace address and city, state, and zip code so that we can track that location for other potential infected patients. For today's example, we'll go ahead and click no. We'll go through and key in the birth date, and we can toggle through the years relatively quickly. So we can toggle back to whatever year is appropriate to match their health records. We'll say this person was born on October 8th, 1980. We can then ask them a time of onset, or the date of onset. Again, this will work very similarly. So we'll say that their onset started last week. We're then going to ask their ethnicity. And again, there are questions that are embedded within this. Since this form is designed specifically around the American Indian Alaskan Native audience, if we select any of the other ethnicities, it's going to take that question and there will be no further questioning. However, if we select American Indian or Alaskan Native, it's then going to ask us, is this individual an enrolled tribal citizen? Self-identification is fine, and they can simply say no. And if they answer the question that they are in fact an enrolled tribal citizen, it's then going to pop up a selector where we can go through and select the appropriate tribe that they are enrolled with. Moving along, we're going to have questions about, is the person under investigation, lab confirmed, or probable? We're going to answer the appropriate questions. We're going to continue through this cycle of questions, answering everything as it comes up based upon the previous question before it. So I'll move along quickly and try to identify a number of these fields for the sake of time in today's tutorial, answering these along. Once we have made our way through the questioning and arrived at the end of the form, we can enter in any additional comments. We can also collect any additional attachments. And attachments could be a document, it could be a photograph, whatever you feel is pertinent, and if it's applicable to attach to this particular investigation. Once the investigation is complete, we simply click the check mark in the bottom right corner. And it's going to ask us if we want to send our survey now, or if we want to continue or save it to the outbox. Essentially, if we click send now, it's going to report this back to our server in real time. And assuming we have an internet connection, this would be the optimal choice. If we're operating in an area where we don't have an internet connection, we're going to save this survey into our outbox. And then once an internet connection is available, we will then send all of our surveys into the server in one group. If for some reason I need to go back and modify this survey, I can do this simply by clicking continue now, or we can reopen the survey later. For today's example, we're going to go ahead and click send now. And just like that, our survey has been sent, and we are back at the data collection application where we could start an additional new survey and continue on. Now, if I had completed this survey and I just realized that I needed to go in and alter it, I can always go down here to the sent window, and I can see the survey I just completed. And if I click on that, it's going to start off by giving me that location, but it will also allow me to go in and edit that application if I need to. So I could go back in and edit and resend this. I could simply view it if we needed to do that. I can look at all of the information about or update that record one more time should I have a reason to. If everything looks good, I could continue on to my next patient, start a brand new survey. Or in today's example, I'm going to go back to our home screen and we're going to take a quick look at our foodborne or waterborne illness survey. Once the form opens, you will notice that the foodborne and waterborne illness cases survey is very similar to the respiratory illnesses survey, and that it starts off with the same geolocation information. Again, this can be automatically pre-populated using GPS, or we could X out and go into the map mode and manually select the location of the patient's home. Baseline data entry will be very similar to the respiratory illness as far as date of entry, date of interview, name, health record, home address information, employment status and location, date of birth, ethnicity, sex, date of exposure encounter is where things start to change. So after the date of exposure encounter, we're going to have very specific information related to the foodborne and waterborne, as far as time of meal, date of event, the type of event. And again, keeping in mind that these questions are built into a smart form. So there's a number of subsequent questions that are embedded in this that only become available if you answer the right combination of prior questions. So we would navigate through the form, answering all of our pertinent information, being sure to check all of the required fields and the subsequently required fields. Again, at the tail end, we can enter in various comments, and we could attach that document or photo if that is applicable. Once the form is complete, we would simply click the check mark to save the form. Again, we have the same options as the last form. We can send now, save to outbox, or continue. And we're going to go ahead and click send now to send that survey back to the server. Occasionally, if you have an internet connection, you might see an error such as this where it says send error. Go ahead and click OK. Click back on the survey and tell it we do want to edit. And try to close the survey again and send now. And just like that, it did send on the second time. Occasionally, you may have an intermittent internet glitch and you may see that error. So it's good to see that while we're going through a tutorial, just to show you that you can simply reopen the survey and submit it the second time, and almost always it will go through. If you are working in the field on cellular signal, you may want to check that you have adequate bandwidth, or wait until you get back closer to town or are on a Wi-Fi connection. Once we've completed all of our surveys for the day, we're then ready to start looking at the data as it's being aggregated into the GIS server. So next, we will go ahead and take a look at how our data is initially visualized and analyzed using a dashboard available through the Secure GIS portal. To access the dashboards and web applications contained in the ArcGIS Enterprise server, you will first need to make sure that your computer is connected to the USET network through VPN. Once connected to VPN, simply open a web browser, and we're going to go to gis.usetinc.org. If you're unable to access this site through your web browser, most likely you are not connected through a VPN connection, and we would need to start troubleshooting there. Once you have arrived at the Secure Enterprise GIS portal, it's going to ask you for your login information. At this time, you would key in your username and your password and click Sign In. Once you have logged in, it's going to bring you to the home page of the Enterprise GIS portal. And for convenience, you will be able to simply go directly to the dashboard or web application of your choice. For today's example, we will start off by going into the Respiratory Illness Cases dashboard. And we can do that by simply clicking on the dashboard icon, and it will open the application. When the application opens, by default, you're going to see a few elements. We are going to see a map that is going to be displaying the investigation locations in a form of a heat map. So the more investigations in a given area that have been conducted, the larger the heat map will be. And as we zoom in and zoom out, that heat map will be proportionate to the general area, so we can scale it appropriately for both large and small scale events to be able to more keenly identify hotspot locations. We have a few gauges available in the dashboard just to give us some really quick heads up information, so we can see the total number of investigations that have been entered. We can see the number of cases that are lab confirmed. I can see the breakdowns of race and ethnicity, as well as sex as defined on the birth certificate. These elements and these gauges around this dashboard can be customized per event. So each epidemic or pandemic, we could customize the widgets or the the real-time data that is displayed on this dashboard appropriately to the case. For the example today, we just use some very basic information to illustrate some of the capabilities. But a really cool function of a dashboard is, again, this information is real time. So as you've seen in the previous example of the field collection forms, if we had 5, 15, or 20, however many people out in the field conducting these investigations that are connected over a cellular connection, literally in real time, we would watch this map update. We would be able to see these hotspots actually forming, and we can adjust these hotspots based upon any number of characteristics. We could symbolize this based off of positive only cases. We could symbolize this off of negative only cases. There's an unlimited way that we could render this data that would be most helpful to support the specific event at hand. But it is really interesting that you would be able to see this data aggregating in real time. So these gauges that we see around the sides of the dashboard would also update in real time. So as folks were closing these out, we would watch that total number of investigations just keep climbing. We would watch those lab confirmed cases keep climbing. And any other characteristics based out of the data collected that we wanted to display in a gauge, a chart, a graph, etc., would be able to be displayed here in real time as we are going through the pandemic or epidemic. Now, at any time, if we wanted to go back to the main screen, we could also go over and we could take a look at our other example, foodborne or waterborne illness. And again, for illustration and example purposes, we set this up exactly like the respiratory in that the same data fields we're using in our gauges and our clustering. And if we zoom in, we can see how that heat map is forming with our 13 total sample cases that we've entered. But in this one, we can see how the data is actually forming more hotspots around Nashville. So if we were to look at a larger area, we can see clearly we've got a problem in Nashville. But if we wanted to zoom down to more of the local level, we can start seeing the isolated hotspots. Where are we seeing these occurrences at? And in this particular case, it looks like we had something going on at Nissan Stadium. So we can see we've got positive cases coming back from there. Again, all illustration purposes, all bogus data, but in a real pandemic situation, we would be able to aggregate this data from multiple clinics or multiple investigators in real time and be able to get, some quick visuals and quick statistics to be able to react appropriately. Now, in addition to the dashboards, we also have the ability through the portal to go in and look at our web applications. And in this case, we set up some very basic web applications just to give us another view or another way to examine the data. So in this particular case, we can go in and we can simply see just the point locations of the individual investigations that are going on. And we can change out base maps. We can figure locations or distances between things. But this is an excellent area where pre-pandemic, in a tribal community or tribal setting, we would really work on developing additional geospatial data sets so that when I'm looking at these locations, we would try, as we say, fair weather conditions. When there's not a pandemic, we would try to establish data sets that are public locations. Where do we have community buildings? Where do we have restaurants, stores, things of that nature, so that we can see in common areas where we might have transmission locations. We could also incorporate things like water sources, grocery stores, any pertinent data sets that we can build now when we're not in an epidemic or pandemic that could be very helpful when we start analyzing the data later. So we could aggregate multiple geospatial data sets into this. Again, in a web application, these are also very, very customizable very quickly in the instance of a pandemic, where we could give a number of different tools, filtering tools, different ways to visualize, ways to load data from other sources. So perhaps I get data from a state or a county health center, other entities. I could add these into this web application and aggregate it together and view it to help me make decisions. Additionally, another convenient way of looking at the data is we can go in and we can actually look at this in a tabular format. Now in this particular case, I've got this filtered by extent, but we can go through and we can remove that filter, and we can say that we wanted to have all of our data sets visual at the same time. So Much like an Excel spreadsheet, I can go through and I can look at the individual health records. I can highlight them in the data set, and I can correspondingly see that blue circle. That is the location of this particular survey. Also from here, I have a very quick and easy way that I could export this out to CSV, so I could take this data out and look at it in a third-party application. And since we're on the subject of data export, in addition to being able to export a CSV from the map file, we can also go into our organization, and I could go into my content or my groups, depending upon how large of an event it is and how many individuals. We have very fine-grained control of who can see what and when. But I could go into my content, or again through my group, and I could look at the actual data services that are behind this. So for example, if I go in and look at my foodborne or waterborne illnesses data set, from here I'm going to have a whole host of different ways that I could export. So I could take this out to a shapefile, to a CSV, to an Excel file, to a file geodatabase. And an inherent baseline of this is I can also go to a REST endpoint connection. So if I'm connected through VPN and you have a geospatial analyst working in your health center or for your tribal government that would be helping you do further analysis, such as link analysis, they could securely connect to this server and pull these geospatial data sets directly into their local GIS software and work in it in a real-time environment. Or we could export it out to those third-party EPI systems. So again, we have a whole host of different ways that we can view and analyze this data as it's being aggregated directly onto the server, whether that be through those dashboards, through a web application, or exporting the data out to an appropriate format that you can then use in a GIS package locally to do link analysis or other types of more advanced analysis, or export them off into very specialized epidemiology software to again, further analyze the data. The workflows, as we've talked about and defined through this application, we really focused based upon community feedback on data collection, simplifying it, streamlining it, and allowing a way for us to get it aggregated into one clean system. A quick way for you to look at the data, and I think we do that in an excellent job through these dashboards to be able to analyze it quickly on the fly as it's coming in and make judgment calls. Again, keeping in mind we can modify and adjust all of these different widgets appropriately to your pandemic or epidemic, and then ultimately making ways for the data to be extracted out of this system and brought in locally to be used in third-party applications, thus reducing data entry. That was one of the big takeaways from our community feedback, was having to enter in investigation data 2 and 3 times into multiple systems. This is a way for us to eliminate that, allowing for a much more streamlined, modern approach. And likewise, being able to do all of this just digitally using tablets and smartphones, Android, iOS, whatever flavor works for your staff will work with this platform. And with that, we thank you for attending this brief tutorial on the Geospatial Community Contact Tracing, Data Collection, and Visualization Tools.
Thank you so much, Garrett, for that overview. Does anyone have any questions about how to use the tool or the practical effects it may have for your work? Again, just because there are so many folks on the webinar, it would be helpful, instead of speaking, if you put your question in the chat, that would be the most helpful, just so that we can reduce background noise. But yeah, if anyone has any questions, now is a good time to put those questions in the chat. And in a few moments, I'll talk about how NIHB is going to support tribes in piloting this. But I want to make space for any questions that may be. And yes, as far as a copy of the recording, we will send out an email to all attendees tomorrow that will include a recording and a brief evaluation that we'll ask you to fill out as well. And I'll also include information on the pilot application. I'll give it just another minute for anyone who wants to put a question in the chat, and then I'll move on to talking about the pilot. Okay, I don't see anyone typing in the chat, so I'm going to go ahead and move on to the pilot. If folks do have questions, we can always circle back. But National Indian Health Board is pleased to be able to offer funding for tribes and tribal organizations, including tribal epicenters and tribal consortia, who are interested in piloting this GIS tool to aid in COVID epidemiological investigations. I put a link in the chat. You can go ahead and click that. We have put out a request for applications. Applications are due on February 25th, so just under a month from now. And you can, that link also has a link to the applications in it. Basically, we are hoping to support up to 3 tribes with funding up to $100,000 to support COVID-19 epidemiological investigations using this tool as a pilot. So that will look like the applicant working with us and Garet to establish that VPN access, like you talked about in the overview, and then training staff to use the GIS tool, and then actually conducting COVID-19 and epidemiological investigations, and then providing NIHB with a preliminary report of findings, and then also recommendations for the tool to further refine its use to tribes across the country. Like I said, we're looking to fund up to 3 entities, and our kind of vision for this is 1 entity with pretty significant GIS experience and expertise, 1 entity with a moderate level of maybe experience, but not necessarily dedicated staff time and things like that. And then 1 entity with little or no GIS experience or expertise. That may look different depending on the pool of applicants that we receive, but that's kind of what we're looking for. And again, more information is available at that link. Just the key points: the funding is up to $100,000, looking to fund 3 tribes, tribal organizations, or tribal entities, and applications are due February 25th. And I think that is all of the points I wanted to make on the pilot. If anyone has any questions, I'm happy to answer them. Garet, it does look like we have a question for you in the chat. Does it include AGOL license seats?
Yeah, I was just starting to type a response on that. So this entire platform is built using ArcGIS Enterprise, which is housed on USET's servers. So ArcGIS Online is not a component of this. So really AGOL licenses are not really applicable. These are ArcGIS Enterprise seats, and yes, there is room provision for those required seats in ArcGIS Enterprise on that server. Next one, I think probably is a question for you, Brett, on the grant side of things.
Yeah, and the question is there a cap limit on indirect or administrative budget costs in the grant opportunity? There's no formal cap. There is also a significant portion of the staff time, and that's why we're hoping to fund in the $100,000 amount. A significant portion of staff time would be devoted to receiving technical assistance from Garet's team on setting up an account and conducting the epidemiological investigation. But yeah, there's no set cap. And again, those applications are due February 25th, and you can find out more at the link that I posted in the chat. All right, I'll just give it another minute for questions for myself, Garet, or Jerry before we wrap up today. Garet and Jerry, would you be willing to put your email addresses in the chat for folks to, if they have follow-up questions? And we do have one question in the chat. Are you saying GIS experience in the area of epidemiology or GIS experience in general? And I think that refers to when I was talking about how we're looking at funding 3 entities, one with significant experience, one with moderate experience, and one with little or no. And I would say that's GIS experience in general. You know, if they are using it, not necessarily for epidemiological investigations. And then another question, what does the $100,000 fund? $100,000 fund. It will primarily be staff time to conduct the investigation and receive TA from Garet's team. If you do have follow-up questions for Garet, Jerry, or myself, we've all put our email addresses in the chat. So you can just jot those down and reach out to 1, 2, or all 3 of us if you do have a follow-up question related to this. And with that, as we begin to wrap up, Jerry or Garet, is there anything else you wanted to say in closing?
Well, I might defer to Jerry if he's got any closing comments, but I'll have just a brief statement on this one, which is the larger area to kind of focus on with this tool is for those that are considering applying for this is to also likewise be thinking about how you would want to apply this to your community. Because as we mentioned kind of through the demonstration, a lot of this is going to be building those data sets that are relevant to your community and kind of tweaking this application for a response appropriate to your community. So there is some thought processes that need to go into, you know, how you intend to use it. It's not hard and fast defined. It's going to be that initial process will be working with your community to figure those elements out. So whether you include that in the grant application directly or it's just something you're thinking about, if you're wanting to pursue this, that'd be my advice, to start thinking about those elements and what that's going to mean to you, because those are going to be some of the very first questions we would have for whoever gets selected.
Brett, I also have a comment. The prototype built on the server architecture at USET is not it was not based upon having a HIPAA compliant server. This was a very short-term project, and having a HIPAA compliant server involves a much more intensive effort than obviously than having a VPN access. We see this as a transportable tool, and we built the prototype on servers that were also being configured at the same time. So there were a couple of concurrent projects, one establishing the servers to build a prototype, and both of those are not HIPAA compliant. So this is a deliverable that we developed as a tool for NIHB to be transportable. And so there are data security elements that would implicate HIPAA, and having a HIPAA compliant server to store the data. I just would like to add that element, since we haven't been explicit about that. So the work was undertaken to address building a prototype, and HIPAA compliance is a concern that you may eventually have to address fully to implement this tool at your tribal location.
Thank you for adding that, Jerry. I think, yeah, that's an important point that you know, may influence folks' applications. I do want to make sure we get to the last 2 questions I see in the chat. We are going to send out a recording of the presentation tomorrow to all registered attendees, and if you are an attendee, you registered for it. So we have your email address, and we'll send that out. As far as there's a second question on if it's a single year grant for the NIHB pilot funding, and yes, that is envisioned as a single year. We do have no cost extension like capabilities, but it's envisioned as a single year grant. to pilot and conduct the investigation and then issue a preliminary report to NIHB with recommendations on refining the tool. And then Jerry, maybe you could weigh in here, or Garet, could we get further information on what a HIPAA compliant server would require?
Yeah, I can try to tackle that. So in essence, the differentiation between the server that is currently in play at USET and one that is HIPAA compliant is really, it's down to the security audits and certifications. The methodologies that the USET server is using to provide the security, going through secure access VPN, is typically going to be similarly the same for a HIPAA compliant server. The difference is the security audits and the assessment and certification. And that security assessment and certification can be expensive to maintain in-house. There are options to lease space on HIPAA compliant servers. So there's a few different avenues to look at with this. The other one that is also in play with these conversations, much like we saw with the COVID-19 pandemic, due to the nature of the pandemic, the HIPAA compliance portions were waived during the initial phases of the response because it was a necessary thing. So in those cases, if you had an outbreak, it's likely you may not have to have a HIPAA compliant server for that time period. But it would be prudent to be aware that you would need to remove the data from a non-HIPAA compliant server once that window closes. And everything that we've gotten built so far is, as Jerry stated, kind of portable. So if the tribe has the resources internally, so if your epicenter has HIPAA compliant servers, it is possible we could work through a number of different channels to get the necessary software licensing to the tribe and deploy this in-house on those servers as well. That is a possibility. There's just elements to work through. And it also looks at your strategy. And that kind of goes back to that question I posed to everyone to think about what this means to your community, because there's also strategies and ways that you can collect and aggregate that data where we can anonymize it. Now, that would limit future analysis, so like doing blockchain analysis and things, but you could anonymize the data down as an alternative route as well. So there's a few different ways to look at this. Looks like the next question there is there software licensing requirements? I'll go ahead and grab that one. With respect to this pilot, working off of the USET servers, the tribe itself would not require any licensing to utilize the servers at USET in this pilot, as the licensing is all residing on that server. The only licensing the tribe would be in consideration for is if, as Jerry mentioned, if you were to at some point maybe post-pilot try to move this onto a tribal server, and there's avenues for obtaining ArcGIS licensing through U.S. Department of Interior's ELA and a few other avenues. But for the purposes of the pilot, you would not need additional licensing in-house.
Thank you, Garet. I don't see any other questions in the chat, so I'll just give it 1 minute as we are approaching the end of our time together. I do also want to send, to give everyone a link to an evaluation survey. NIHB puts on webinars pretty frequently, and we are always hoping to generate content and information that's relevant to you as tribal public health professionals. So please do take a couple minutes out of your day today, click that link and give us your feedback on this webinar. It should take about 2 minutes. And if you don't capture that link, we'll also send it out in the follow-up email tomorrow. And if you are registered for the Tribal Environmental Health Programs Engagement in COVID-19 Response webinar series, the next webinar in this series will be February 23rd at 4 p.m. Eastern Time. If you registered for this webinar, it should have generated a calendar invite for that webinar. And we will have an agenda and content list for that webinar on February 23rd for too much longer. So with that, seeing no other questions, I think we can go ahead and wrap up here. Thank you so much, Jerry and Garet, for sharing your time and your expertise. It's been a pleasure to work on this project with you, and I'm really excited to see what the pilot brings. And thank you all so much for joining us today and listening in. Like I said, there will be a follow-up email sent out with more information shortly. And again, please do send in applications to pilot the GIS tool. Those are due February 25th. Thank you so much and have a good rest of your day.